Good evening. Happy Labor Day. Dan Delmar and Robin Flynn with you today. Aaron is back tomorrow. We are talking a lot of workplace and labor issues on the program today, of course. Let's go to the nursing situation. 500 days now without a collective agreement for the FIC, which is the nurses union. Why is this continuing to go on? The pressure tactics are going to be escalating right now. So we're hearing that the nurses are going to refuse overtime beginning September 19th. So the clock is ticking. As I said, that's just 17 days away, and that can certainly exacerbate problems in the healthcare system. Jenny Rees, president of the MUHC Nursing and Cardiorespiratory Professionals Union, affiliated with La FIC. Hello, how are you?
Afternoon, Mr. Delmar and Ms. Flynn. Thank you again for having me.
Our pleasure. Thanks for joining us. So first, in terms of this deadline, I suppose, to avoid nurses refusing overtime, do you think it's reasonable that or realistic, I should say, for a deal to be worked out in the next couple of weeks? Because that deadline does seem like it's looming.
It is completely looming. As you mentioned, we are 521 days today without a contract. And with the CAC's latest offer, which is quite frankly, it went from bad to worse, and it is really making us a lot more agitated and angry. We are more determined than ever, and it's something that is going to happen in a few weeks, that we're no longer going to take on overtime. We've asked our membership to stop. And it's really sad because right now, scheduled overtime is a regular thing. It's a part of the schedule. It's forecasted long in advance when the schedules come out, as well as independent labor, which is not really a part of our MUHC reality, but it is across the province, yes.
What would that look like in real world example to have no nurses agreeing to overtime? I like to sort of paint a picture here. What sort of impact would that have on patients? Because I'm sure the government will tell us it won't impact patient care, but I bet it will.
Oh, you would be 100% right. I think this government is either deaf, dumb, or blind, but there's a real problem. They've denied that we were at an impasse. We've been at an impasse since July the 10th. They've denied that it won't impact patients. How could it not? Even with people voluntarily doing overtime, we have units that are minus 10, minus 11, minus 12 per shift. People are running their feet off. We are, foregoing our breaks, our lunches, and sometimes we don't even have time to use, the washroom. It's that bad, and we put our patients' needs first because we don't have a choice. What the government, I want them to understand is we're not doing this to be difficult. We're doing this because we are extremely concerned. We have been saying from day one, this is a safety issue. It has nothing to do with just necessarily our needs. But when you ask a nurse to move from one location to another without any consideration of their expertise or their specialty or their chosen field or where they want to go in specific relation to where they work and who they work with on a daily basis, you are playing with fire. We've been saying this from day one, and it doesn't seem to be getting through to them. Now, the latest offer, you should know, they've removed the kilometers. And I think they think in their minds that this is great. We were talking about the 25, 35 kilometers that was problematic to us. Now they've removed it. Okay, and now they're saying it goes back to the institutions. Well, the institutions, as of December the 1st, are done. We are one. We are Santé Quebec. You would not need a degree in rocket science to figure out, well, as of December the 1st, they can move you anywhere. There will be no geographical boundary.
So is there no voluntary component to this? So you're saying the employer, the hospitals, or the CIUS can ask nurses to go literally anywhere in Quebec, send them far away. Is that something that you're afraid of for your membership?
Well, I think that it wouldn't make sense to transfer people, let's say 200 kilometers, but there are areas where it's thousands of kilometers apart. Now, you would think that doesn't make any sense, but with this government, we have no faith, in essence, that they won't do it. And I've even seen proof right now that the CSQ union who signed early June, I'm seeing letters that their members are receiving that they are changing their locations. And you should know that this was also a pilot project that was done with Centre Mauricie du Québec last year. And within 2 months, they had 200 resignations from their healthcare professionals who said, sorry, can't do it, won't do it, and they just resigned. Now, what's really alarming to us is that with what's going on, a lot of our nurses, and there were articles published last week, our nurses are saying, according to our slogan, there's a limit, that they've reached their limit. They are packing up and they're leaving, or they're leaving the profession, or they're retiring. And this is an exodus that the government and the population of Quebec, we cannot afford, especially now. And I'm so sad because we don't want the public to be affected. We don't want our patients to suffer any more than they're already suffering. But this is a direct consequence of a government that is not stepping up to the plate and taking their responsibility and doing the right thing.
And this is also a government that 5 years ago said they were going to put an end to mandatory overtime altogether, and they kind of went back on their word. So when you look at it from that perspective, how do you have faith that they're going to be able to negotiate with the nurses right now?
We don't have any faith. And Robin, last week and throughout this entire negotiation, it's been a media war. They are vying for public support. And I hope the public understands that it is ludicrous. Okay. It doesn't make sense. They're playing with people's lives and they cannot continue. I hope the public will give them a clear message next fall at the ballot box. That's ultimately what I think is going to have to take place, because Santé Québec is the biggest bureaucracy Quebec has ever created. It's a centralization of healthcare services, and already we're seeing the negative effects. Okay, and I'm very concerned that if they are allowed to continue, we not only won't reach a contract, but you won't have the staff that you need to maintain a decent healthcare network.
In terms of how to improve the healthcare network, some people in medicine that I've worked with have told me that balancing resources and having some flexibility among staff is important. For example, if one hospital in the Montreal area is at 200% capacity and the other is at 50% capacity, that might be an instance where you may want to move some medical personnel around there. Is that scenario? Are you open to that scenario as nursing heads?
We are open to that scenario, but on a voluntary basis. During COVID, we had that scenario. We had areas, the CHSLDs, where the patients were literally dying. And we were asked, as healthcare professionals, hey, guys, we really need a hand over here. We went by the truckload, and we did it voluntarily. We were monetarily, some of them were compensated, and we solved the problem. I think if the government were to take a step back and say, you know what, this national float team that they're trying to create, sorry, it's not working very well because it's not attractive enough. There's not enough people applying to it. But if they were to think, logically, they would take the resources that they want to remove from independent labor, the agencies, and maybe invest in a national float team where the people will be mobile and go to those problematic areas with staffing issues, then I think you're talking that we can have this discussion and how can we help you? At our MUHC, when we have massive staffing discrepancies, the head of nursing reaches out to us, the union, and say, can you help us? We put a call out. We know people who are working part-time who could give a hand here and there, and we make it happen. We have that level of collaboration. But this government is pushing us to the wall, and it's pushing us closer and closer to the edge, and many of us are just jumping off, unfortunately.
Is it? I come back to the resource balancing issue though, because in an executive decision, and I think this is what Santé Québec hopefully will become, is a agency that can make very fast decisions about the healthcare network to improve outcomes very quickly. So if one week, one Montreal hospital is in dire need and there's no volunteers to go there, do we just give up on the idea of resource balancing? And shouldn't there be some prerogative for the employer there to move those human resources around?
I understand what you're saying, and it's a very two-edged sword. Okay, there are reasons why some areas are short and some shorter than others. I think you ultimately have to think about safe patient ratios. I think you have to improve the quality of care and also our working conditions, because it's not normal to work in these conditions. It's not normal that you're going to come back so exhausted that your next day off is spent in bed because you're so tired. It's not normal that we've been bleeding healthcare professionals for this long, that people are leaving by droves because they can't take it anymore. I think you need ultimately to establish safe ratios. You need to give us some say in our own schedules, which is on the table as well. I understand what you're saying, but there are reasons why some hospitals are short. Okay, and I like to say that, it's perhaps due to the lack of management, planning, foresight, things like that. If that's the situation, then sometimes you can close beds and those patients will be rerouted to a hospital that can manage them. We're already doing it.
All right, fair enough, Jenny Rhee, and also, these negotiations are way more complex than any one issue. It's a lot of different working conditions that go into this debate, and I wish you the best of luck because you nurses, of course, one of the bedrocks of the society. So thank you, Jenny Rhee, president of the MUHC Nursing and Cardiorespiratory Professionals Union, affiliated with the FIC. Appreciate your time.
Thank you very much for having me.